And we begin in North America, where President Donald Trump has tweeted that he'll be leaving the Walter Reed Medical Center later this evening, confirming what his medical team had suggested on Sunday. The US president is being treated for COVID-19 and has received a series of antiviral treatments, including a steroid for lung support, raising questions about the timeline of his discharge. Well, Trump's medical team says that he's not had a fever in more than 72 hours and his oxygen levels are normal. So let's get a little bit more on this as we speak to our US correspondent in New York, Sherwin Bryce-Pease. Sherwin, thanks very much indeed for joining us. This doctor has stood on those steps quite a bit in the last few days, and after each announcement, more questions were raised. Are we a little bit clearer today about the situation with President Trump?
A colleague of mine just tweeted, Peter, worst, period, doctor, period, which means full stop, ever, period. That's not coming from me, but that's kind of the sentiment people have, just given the level of disinformation. Did he get oxygen? No, he didn't get oxygen. I don't want to tell you about this, not really answering, very critical questions. But this is what we have in addition to that tweet. Yeah. The president continues to improve, according to his physician, Dr. Sean Conley. He's not entirely out of the woods yet. This is something we've been reporting constantly because given the trajectory of the coronavirus, the COVID-19 virus in the body, it goes up, it goes down, it bounces around. You feel better one day, you can feel worse the next day. So he's not out of the woods, particularly given his high-risk category 74. He's male, a number of underlying conditions, including high blood pressure, obesity, and some cardiac issues. They say that his kidney, liver, and cardiac functions are now normal, and that he will continue to receive world-class medical attention at the White House when he is discharged later today. They talk about the fact that he had reached the discharge criteria as early as Sunday, and that support, of course, now will travel with him to the White House. Refused to answer specific questions as to when the president last received a negative COVID-19 test. And this is important, Peter, in terms of contact tracing, so that you can really identify who was around the people, who was around the president after he had tested positive the first time. We're not getting clarity from the White House on that. He talked about being in uncharted territory for the president, given the experimental antiviral treatments that he has been administered so far, in addition to remdesivir and the dexamethasone, which is there for lung support. He received a third antiviral therapy that has not been approved by the Food and Drug Administration. So they are in uncharted territory as to how an individual will react having received all three of those. He also said, Peter, that there was no evidence of live virus that the president can transmit at the moment. So that seems to speak to the permission slip they're giving him to return to the White House. We just don't know how he will be isolated at the White House and whether he will be returning to the Oval Office and how he will be handling his functions as president, if he's going straight back to work as normal or not. These are some of the open-ended questions we still have.
I mean, some of these drugs that he's taking are supposed to be taken in hospital, and the steroid in particular, if I remember correctly, they had said that this was only used in extreme cases and that it didn't help people with mild symptoms. So it's quite telling that they would be giving it to the president.
Well, the WHO says that it is a drug that is administered for critical patients suffering from COVID-19. So that doesn't flush with the narrative that is coming out of the White House from his medical team saying the president is doing well. It's a very rosy picture. In fact, the doctor was quoted a moment ago, quote, "He's back," as a nodding your hat to Arnold Schwarzenegger in The Terminator. So the president is back. The sentiment we are getting from his doctors is that he's doing very well. He's rearing to go despite all these therapies. But they do add that he's not out of the woods yet and that they will be closely monitoring his progress at the White House. And of course, this is the president of the United States. I don't think we can frown at the fact that he'll be going back to the White House, where he will probably receive equivalent support, just given the infrastructure that they have for the commander-in-chief there. So, something to watch very closely, certainly as we reach that 7 to 10-day period where we are told is a critical period for recovery for patients with the number of underlying conditions that Donald Trump has, but also because he's that high-risk category at 74 years old. A 74-year-old male tends to have worse outcomes than perhaps someone younger, Peter.
And as you were saying, I guess the complication of this is that we don't really know what the timeline is with this guy.
We don't know the timeline, but the greater complication is that this is not just limited to the President of the United States. The breadth of the spread out of the White House precinct, going back to that nomination ceremony for the Supreme Court nominee last Saturday. And what we have heard subsequently is that the list of people infected, in addition to the first family, continues to grow. Just this morning, the press secretary, essentially his spin doctor, Kayleigh McEnany, tested positive. And Peter, she had not tested positive yesterday or the day before, or since Thursday, when we got news that his senior advisor, Hope Hicks, tested positive. So what are we learning about testing today? Yesterday you could have been okay, but tomorrow you might not be. And that, flies in the face of them using testing as a reason or a defense for not socially distancing within the White House precinct, not washing your hands, and not always wearing a mask. In fact, Ms. McEnany was on the White House grounds speaking to reporters. Yes, she might have been 6 foot apart, but she wasn't wearing a mask. And we understand now that a number of White House press corps reporters, 3 so far, have now also tested positive for COVID-19. So the magnitude of the spread, with the White House as the epicenter, it continues to grow. In addition to Chris Christie, his debate advisor, who has checked himself into hospital because he suffers from asthma. So we don't know the extent of the spread, but what we are seeing is that the drip effect continues.
And Donald Trump, always out to shock, amaze, surprise. He goes on a little drive about yesterday.
Well, you're supposed to quarantine for 14 days when you get COVID, Peter. You're not supposed to leave the hospital, or you're not supposed to leave your apartment or the room that you're isolating in. I mean, so many people have done this before, but the president felt he needed to go and thank his supporters, and tweeting earlier that it's the media that is upset. The media is upset about this when epidemiologist upon epidemiologist is saying you should not have done that because you're placing the people in that hermetically secure car of his, essentially an airtight car. The Secret Service guys that were in there with him are now at risk of having contracted COVID because the air essentially circulates in that vehicle. So a lot of unanswered questions. But the president tweeting a short time ago that don't be afraid of COVID, don't let it dominate your life. We've developed under the Trump administration some really great drugs and knowledge. I feel better than I did 20 years ago, Peter.
So what's been the fallout? I mean, the Democrats, we don't even need to ask because we know what they're going to say, but is there some fatigue setting in now with the Republicans who probably at a loss for words in terms of how to explain what's going on?
Peter, this is not the first time that Republicans have been on the sidelines of a president sort of running amok and saying things and doing things that are antithetical to what the science is saying or to what reasonable people would do. So they are pretty quiet about this. They do talk now about wearing masks, but they're very focused on his Supreme Court nominee. And they've, of course, expedited her nominating process because the poll numbers are not really showing anything favorable towards the president. We saw an NBC Wall Street Journal poll come out earlier today that gives Joe Biden a 14-point lead in the race for president. So that has expanded since the debate. So I think whether Republicans in Congress are fatigued or not, I think there's an element of fatigue that is settling into the greater population here in the United States. And I think the poll numbers are beginning to reflect that.
All right, Sherwin, we're going to leave that for the time being. Perhaps we'll catch up with you when Marine One lands at the White House. But for now, thanks very much.
Thank you, Peter.
All right, that's Sherwin Bryce-Pease, our US correspondent in New York. Donald Trump's going home, it seems, and, we believe that he'll get equal medical attention at the White House as he's getting at the hospital, which begs the question, then why did he go to the hospital in the first place?